Hello, my fellow MSSNY 2023 delegates. My name is Alex Steinschlager. I'm a urologist. Because of the limitations of the House of Delegates format, with only 60 seconds to discuss a resolution, I want to take a few minutes of your valuable time to address my Resolution 62, Withdraw and Amend Virtual Credit Card Policy. This is a little bit of a complicated resolution related to federal regulations and how the AMA is responding to it. I want to provide you with sufficient background information to make an informed decision and support my resolution with the original resolved. As you may be aware, health plans often pay with virtual credit cards, which cost a lot of money, 2 to 5% of the revenue for medical practice as well as hospitals. For example, a hospital in Florida is paying more than $1 million in these fees to health plans. They basically extortion. The AMA has been advocating about this issue for many years. However, the AMA unfortunately put out a few statements on its website and its communications that are not based in any law or legal reasoning. Instead, what happened is that the health plans fed this verbiage to CMS. CMS put this verbiage on their website, and the AMA copied this verbiage from the CMS website. What's happening now is that instead of CMS quoting health plans as the source of this version of truth, the CMS and health plans are quoting the AMA as if AMA endorsed this verbiage, and it's hurting us. It has no basis in fact, and it needs to be revised and removed. How do I know this? I think some of you may be aware that I have been an advocate for this issue for the past 4 or 5 years. I filed many complaints with CMS, as well as I filed Freedom of Information Act lawsuit against CMS to obtain all the inside information about this issue. So in fact, I have more information that the American Medical Association has known about this issue, and I have provided some of that information to AMA. However, it seems that it has not been reflected in the AMA thinking on the issue. I'm a big supporter of the AMA, but on the other hand, when AMA is not doing something that is in our best interest, I think we need to step back and criticize the AMA and force it to correct itself. This is the role of the delegates to MSSNY, as well as our delegation to the AMA. This resolution is the only way that rank and file physicians can make a difference at the AMA. In fact, this is, I think, is one of the reasons that only 20% of American physicians are AMA members, because AMA does not like to correct itself when it's wrong. So I request that you support this resolution in its original format. The original resolution states that the MSSNY advocates that the AMA withdraws erroneous statement that virtual credit cards are legal or not illegal. The AMA is using another word such as permitted or valid. As a matter of fact, while credit cards are valid to go shopping at a grocery store, there is a federal law called HIPAA Administrative Simplification Requirements. Part of that law is that it established a single valid method for healthcare electronic payments. That method is called ACH EFT, and that's the only legally allowed method to pay healthcare practices, physicians. Any other method is illegal and invalid. instead of the AMA writing that it's a valid method, which is the position that United Healthcare Optum VPay takes, which is one of the vendors that sends virtual credit cards, as well as Zealous, the AMA should take the opposite position. An actual legally valid position is that it's an invalid method. The result of the fact that AMA puts out, brochures like this, misleading brochures that have no basis in fact or law, is used by health plans to argue with CMS that AMA agrees with their vision of defense. This is irrational. The AMA essentially taking the position of the health plans that are stealing money from us. This is unacceptable. I think the AMA needs to revise these. I've been talking to AMA about this for 2 years or more, and nothing has been done. I ask you that to support this resolution, the AMA needs to be accountable. Just like each of us are accountable in terms of the medical care we provide, the AMA needs to be accountable, and this resolution needs to be supported and passed. The reference committee, tried to water down this resolution and make it meaningless. I request that you reject the reference committee recommendation and adopt the original resolve. I would be happy to discuss with you any law and the regulations that are involved here. The AMA has never been able to support, and the health plans and CMS has never been able to legally support the statement that VCCs are permitted. In fact, the guidance that CMS issued, on the bottom of that guidance where it says they are permitted, it says the guidance says it has no legal force, right? And if you actually read the plain language of the regulations, it clearly states that there is only one single adopted method of electronic payments for healthcare transactions to physicians, and that's the ACH EFT, and virtual credit cards are excluded. Now, if there is only one legal way to pay, that by definition means that any other method is illegal. So by definition, virtual credit cards have to be illegal because EFT is the only federally recognized standard for payment. Again, if you have any questions, I would be happy to discuss this. I request that you support this resolution as originally submitted. Thank you very much, and let's advocate for our needs and our rights.